Hello guys, welcome to my YouTube channel. My name is Anua Kiyemi. So by the title of this video, you already know I'm talking to my professionals. I'm talking to my nurses out there, and this is just me talking as a nurse. It could also be useful for someone who is not in the nursing line, who is not in this kind of profession, but can also be helpful if you think about it and use it in a way to suit your work. Without wasting our time, let's get to it. So I said 5 things to do to help you have a successful shift as a nurse, and this is not in any order of priority, or it could be in order of priority, but right now I'm not putting in order of priority, but those are just the things that you should do or that you could do to help you have a successful shift. Number one, prioritization. Getting reports from the previous shifts, you should be thinking, okay, who am I going to prioritize in this case? Who am I seeing first and who am I going to see last? You think about that. So you, at the beginning of the shift, once you're getting your reports, that's what should be playing in your head. Or once you're done with your report, that's the thing that should first of all play in your head. Like, these different patients, they have different needs. What needs am I going to do first? What need am I going to prioritize based on the importance, based on the critical level, or based on how needy they can get or they can be? Okay, so you think about these things and prioritize who you're going to be attending to first, next, and the next, till you're done with everybody. Okay, another thing you should do, that will be point number 2, is sit down after getting that report. A lot will be going on in your head, a lot will be processing in your head, especially when you've gotten those reports that seems like it's going to be too much work for you to do for that shift. Look into the notes, take a deep breath. That's another thing, that's another way. And from there, you might see some things that were missed out, or things they didn't tell you, or things that you think would help you help that patient during that shift, that maybe was not necessary for the previous shift to use, but it will be very important for your own shift. So you look at them, you look at the patient's notes, you look at the patient's medication, you look at what the person has gotten, what the person would get during your shift, and what would help that person have a good shift with you. Number three on the list, and like I said earlier, it's not in any particular order. I'm just saying like 5 things that I believe would help you have a successful shift as a nurse. Flexibility, guys. Be flexible. And this flexibility, it comes with what I would say later, the positive energy. So be flexible in the sense that you might have things going on well for you, and things can switch. It can go from 0 to 100. It can move from 0 to crazy. You know that this thing should be at the back of your mind, that okay, your flexibility should always be there. It should be top notch, that things going from 0 to 100 will not weigh you down. You will keep going because you know you cannot quit. Of course you cannot quit. You cannot give up at that moment. As soon as you clock in, you know you're not giving up. You know there's no going back. So be flexible. Sometimes it can be going smooth. It can be going nice. It can be going on a smooth sail. It can be going on a nice pace. And just in a twinkling of an eye, things will just go south. Your flexibility would help you It will keep you strong, and you'll be able to deal with whatever is happening at that moment. Before is that you should have a positive mindset. You should think positive as soon as you step your foot to that your place of work. Have a positive mindset. Let all your focus be positivity. Let all the bad energy drop. If you've gotten a bad energy from the one that is giving you report based on how the person or the patient reacted or dealt with, or they had their dealings during their own shift, don't use that energy. Drop that energy and get your own positive energy, a fresh one, like a fresh oil, fresh positivity for that shift. And think positive once you're entering all your patients' room to do anything for them. No bad energy they give you, you won't be receiving it with, anger, because you are coming with a positive energy. You will be able to deal with the situation. You will be able to help that person have a nice shift with you, and you would also have a nice shift to the person. So my own thing is have a positive energy as you're going for that shift. Another thing, which is the fifth point I'm going to mention, is always ask for help. Always ask for help, guys. If you ask for help, you will not be drained. If you ask for help, things will go very fast, very smooth, and you will not have the burnout. Oh, person A, I can deal with this person, or I have to be the person as their personal nurse to deal with their case. Person B, they only need something minimal, but I still have to give it to them. They need it right then. You can always get another person to help you with whatever is needed, just so that you are not drowned during that shift. Ask for those help and let people help you. If there's someone that's done, or they're done with their own, with whatever they're doing with their roles, they can help you. But they're not going to know that you need help if you don't open your mouth to tell them that you need help. So you have to be open that mouth, ask respectfully for their help, and they'll do it for you while you do something else. And at the end of the day, you get like some chunk of time to rest. This brings me to the end of the video. I try to make it short. I try to make it brief so that I don't bore you, okay? I try not to give like too much example so that I don't bore you still, okay? So if you are still watching and you have not liked this video, why now? What are you waiting for? Please help subscribe, like, give a thumbs up to this video, and share the video. Thank you, and I will see you in another video.